All right, so today we're diving into something that I think a lot of guys, especially those considering or maybe already on testosterone therapy, are going to find really interesting. We're talking about SHBG.
Sex hormone binding globulin, yeah.
Yeah.
It's definitely something that comes up a lot and honestly can be a bit confusing.
Exactly. It's one of those things that you see on your blood work, but you might not really understand what it means. So we dug into some research and we're going to break down why this SHBG matters so much, how it affects how well your treatment works, and all the things that can actually influence your SHBG levels.
Yeah, I think the goal here is to give everyone a clear understanding, cut through the jargon and all that.
Absolutely, because at the
Yeah,
end of the day, you want to know what's going on in your body and how it impacts you.
right,
Okay.
sure.
So first things first, for anyone who's hearing this term for the first time, can you give us the layman's explanation of what exactly SHBG is?
Okay, so SHBG is basically a protein, right? And your liver makes it. Its main job is to bind to testosterone that's floating around in your bloodstream.
Okay, so it attaches itself to testosterone. So what happens when it does that? Does it I don't know, change it somehow?
Yeah, it's a good question. So think of it this way. Imagine SHBG as like a taxi for testosterone.
A taxi. Okay, I like where this is going.
Right. So only the testosterone that's not bound to SHBG, the stuff that's not in the taxi, that's what we call free testosterone. And that's the only kind your body can actually use.
Oh, interesting. So the testosterone that's hitched a ride with SHBG, it can't really do much.
Exactly. It's essentially inactive until it gets released. So you see, SHBG is like the gatekeeper. It controls how much testosterone is actually available to do its job.
Okay, so that makes a lot more sense. Now, how does this whole taxi situation actually play out when someone's on testosterone therapy?
Well, that's where things get really interesting. So let's say you're getting testosterone therapy. If your SHBG levels are high, a lot of that testosterone you're getting is going to get bound up by SHBG, right?
Right.
Less of it will be free to do its thing.
So even if you're getting testosterone, it might not be doing you much good if your SHBG is too high.
That's exactly right. And what's even trickier is you could have what looks like a normal total testosterone level on a blood test. But if your SHBG is high, you might still have low free testosterone and all those pesky low T symptoms. Like fatigue, low libido, not feeling as motivated, maybe even losing muscle.
So that means just looking at total testosterone on a blood test, it's not the whole picture.
Yeah, not at all. That's why looking at SHBG is absolutely crucial before and during testosterone therapy. It helps you figure out if the therapy is actually working the way it should.
So if someone does have high SHBG, what can be done about it?
Well, there are a couple things. First, like we talked about, your doctor might need to adjust your testosterone dose. If your SHBG is high, you might just need a higher dose to make sure you have enough free testosterone to actually feel a difference.
Makes sense. And what about anything else, like lifestyle changes? Do those play a role?
Yeah, absolutely. Things like diet and exercise, they can sometimes influence SHBG levels.
Yeah.
So that's definitely something to talk to your doctor about.
Okay, good to know. Now, I noticed in the stuff we were reading that age also plays a role in SHBG levels, right?
Absolutely. Generally, as we get older, our SHBG levels tend to go up naturally, and that means less free testosterone. So as guys age, they might need adjustments to their testosterone treatments to keep things balanced.
Interesting. It's like this moving target almost. And is SHBG just about testosterone, or does it bind to other hormones too?
It does. SHBG also binds to estrogen, so it's actually involved in regulating the balance of both of those key sex hormones.
So it's like this, like a master regulator. And it's important to get it just right. What about if someone has low SHBG? Is that something to be concerned about too?
Yeah, you definitely don't want to swing too far in the other direction either. Low SHBG can mean you've got way too much free testosterone floating around, which can have its own set of problems.
So it's all about finding that sweet spot, right?
Precisely. Balance is key. And that's why regular monitoring with a specialist is so important. They can make sure your testosterone therapy is tailored to you and that you're getting the best possible results.
So regular checkups are non-negotiable. And are there any other things that can affect SHBG levels besides age and lifestyle? I seem to remember something about liver function.
Yeah, you're right. Liver problems can actually throw off SHBG production. And another big one is insulin resistance, which you see a lot with prediabetes and diabetes. That can also mess with SHBG levels, usually making them lower.
Wow, so many factors at play. This has been a really enlightening look at SHBG. So I guess the takeaway here is, guys, if you're thinking about testosterone therapy or you're already on it, don't just focus on that total testosterone number. SHBG is just as important.
Couldn't have said better myself. It's all about how much testosterone your body can actually use.
And when you think about your overall health, it makes you realize that things like your age and your lifestyle, they can have a huge impact on your hormone levels in ways you might not even think about. What other questions does this raise for you about your health and well-being? It really goes to show how interconnected everything is.
Absolutely. You can't just look at one thing in isolation. It's all about the bigger picture.
And that's what we're all about here on The Deep Dive. So thanks for joining us, and we'll see you next time.
See you then.